The next part of the examination is to evaluate the pulses. So very briefly, we have the femoral pulses in the inguinal area, we have the popliteal pulse behind the knee, and at the foot we've got the dorsalis pedis, and we've got the posterior tibialis pulse. Just to say briefly, the popliteal pulse is very hard to find. The most experienced vascular surgeons may struggle to locate the popliteal pulse. So in this case, we're going to omit that test. Equally, the femoral pulse, it can be quite awkward for patients. It can be difficult to find. So in this case, we're going to omit that. The most important pulses that we would want a physiotherapist or an MSK professional to be reviewing is the pedal pulses. Okay. So for the dorsalis pedis, I like to come straight on. I like to test these together. So we want to come down from the ankle to the navicular region and use 3 of your fingers on either side. And we want to be able to see if we can palpate, or we can feel the pulse in there. So he's got a very strong one in his left foot, and it's essentially absent in his right foot. Okay, so we'll talk about that in a second. So we'll take a note of that. The next thing to do when we're looking at the posterior tibialis is to rotate the leg around. 3 fingers again, but just behind the medial malleolus, perhaps between the Achilles and the malleolus. It's a little bit deeper with this one. Don't be afraid to slightly adjust your fingers if you're struggling to find that. I tend to find that it's slightly closer, almost underneath the medial malleolus. If you're struggling to get the pressure, the depth, you might want to just use the other finger just to ease it in.